The additional $75 million that the Department of Mental Health and Substance Abuse Services is being asked to cut represents nearly 1/4 of the agency's entire budget. Mental health professionals say if lawmakers don't come up with additional revenue, Oklahoma will experience catastrophic consequences.
People often look the other way when they see homeless on the street. But by cutting 23% of funding to the Department of Mental Health and Substance Abuse Services, Oklahoma will not be able to turn a blind eye to the mental health crisis, which was already escalating before this latest budget gouge. That's according to mental health professionals across the state.
It's not a crisis. It's not even a catastrophe. It is a complete decimation of the state of Oklahoma.
I'm going to cry. I mean, we are seriously at a place that if we don't do something, we're not going to be able to do anything.
If this goes through, this is devastatingly catastrophic, and it guts the entire mental health and social service system. We just went back 67, 70 years.
People we elected, people that are supposed to provide service to the state of Oklahoma, they need to know that people are going to die. People are going to die.
Janet Cizek is the Chief Operating Officer for the Center of Therapeutic Interventions, which has 4 counseling offices in Northeast Oklahoma. The Department of Mental Health and Substance Abuse Services reimburses CTI for the treatment of nearly 60% of its patients.
We're hearing things about either cutting outpatient care altogether or cutting inpatient care altogether, doing away with programs that are unbelievably 87% effective, like drug court, completely eliminating them from our state.
If outpatient reimbursements are cut altogether, people in dire need across the state will have no place to get help. That Cizek says can mean the difference between life and death.
And when a pregnant woman who has an opioid addiction cannot get care, cannot get life-saving medications to prevent her from going into overdose, she will miscarry. And so we're not only talking about somebody not getting appropriate care, we're talking about the loss of a life of both mother and child.
Dr. Jason Beeman is the chairman of Psychiatry and Behavioral Science at Oklahoma State University's Center for Health Sciences. He says cutting all inpatient services will mean shutting down the state's 4 psychiatric hospitals where the sickest of the sick are cared for.
These are the state facilities that manage people without insurance and the majority of patients in crisis in Oklahoma. People who are violently dangerous and mentally ill, people who are suicidal, and people who are just so psychotic that they can't eat, they can't drink.
The Tulsa Center for Behavioral Health is a state psychiatric hospital. Dr. Beeman says most people don't even know that.
They don't know that the police are transporting mentally ill patients to that facility 24 hours a day. And that hospitals are transporting patients to that facility from all over the state 24 hours a day. So they don't notice that they're there, but I promise you that they absolutely will notice when they're gone.
The Denver House in Tulsa and the Lottie House in Oklahoma City are drop-in locations for homeless and those suffering with mental illness. It's where those troubled people are connected to support services to help them out of their fragile circumstances. The houses are run by the nonprofit organization, the Mental Health Association Oklahoma, but they are completely funded by the State Department of Mental Health. Denver House alone serves 14,000 people a year. Mark Davis is Chief Programs Officer for the Mental Health Association.
If a place like this goes, then they go right back into the community. They're going right back into the day centers. They're going right back into the homeless shelters. They're going right back into the jails, whether it's Tulsa or Oklahoma City. That's where they're going.
Wendy Freilich is the Chief Administrative Officer for the Mental Health Association.
It's going to eventually impact everyone. 1 in 4 people have a mental illness. If you say, okay, out of those 1 in 4, 1 in 4 has a serious mental illness that allows them to get access, then you're saying 3 in 4 aren't getting access. I don't know how we live with ourselves. I don't know how legislators say that's okay.
Those interviewed for this story say lawmakers need to raise revenue now.
We need a call to action for a vote right now. I want to know. I'm tired of the closed door politics. They should be open forum discussion. I want to know. I want to watch it on TV, I want to go to the Capitol and I want to see the discussions that are happening, because I don't know that these people understand what they are doing.
Honestly, I can't think of anything that's done more damage to the state of Oklahoma, or would do more damage to the state of Oklahoma, since the Great Depression.